And there is one more question, I think. So how can I qualify or get signed up for a targeted therapy trial if my physician isn't advocating for that, but I believe I qualify? You should advocate for yourself. I think, if you believe you qualify for the study, if you found the study on clinicaltrial.gov, or what Millie said, looking at the report of the NGS, which was excellent suggestion. If you click on that link or put the name of the clinical trial, each clinical trial in the United States has a number. So if you go on clinicaltrial.gov, if your Foundation Medicine recommends that trial, there's going to be a number. So you click that number, you put it on the website, and you scroll all the way down, and then you'll see which states have the trial open. Unfortunately, with clinical trials, you will have to travel. So you cannot live in California and receive a trial at MD Anderson in California. You have to travel to MD Anderson to go on that trial. So there's a financial risk involved with that as well. But if there is an academic site, or even some community sites have clinical trials, that's where you find that information if you qualify for clinical trial.
Yeah, I agree with that. And then you can also talk to your, treating oncologist about about the trial that you may be interested in. And oftentimes when I am seeing patients, and if I know that my particular institution doesn't have a clinical trial, I'll reach out to my colleagues who are at UCSF or UC Davis. And because the trials are constantly opening and closing, and there's various cohorts, and it can be very difficult even for us to be able to keep track of what's going on at our own institution, let alone at other institutions. And so when you're at the point of needing a different therapy, I think kind of taking a time out, stopping, and exploring the clinical trial options, either at an institution nearby, or even, I think, within a few hours drive. I think what's challenging is, you may be eligible for a potential trial now, or potentially eligible if you have disease progression. But, the hope is, of course, that you won't have disease progression for quite some time. And by the time you have disease progression, there may be novel therapies, new FDA-approved therapies, new trials. And so it's so dynamic that it's difficult to be able to say, I'm potentially eligible for this trial, but, maybe not at this point. If you're on a therapy that's working for you, then, we wouldn't want to necessarily take you off that therapy.